May is Mental Health Awareness Month, and the National Institute of Mental Health says about 1 in 5 adults experience some sort of mental illness. Joining us right now is Arlie Rogers, a licensed professional counselor with ThriveWorks here in DFW. Good morning to you.
Good morning.
Glad to have you here. How many people here in Texas are actually impacted by mental health challenges?
Well, mental illness can affect persons of any age, race, religion, and socioeconomic status. According to the Texas National Alliance on Mental Health Illness, 796,000 adults in Texas have a serious mental illness. The CDC goes even further to say health disorders account for more disability than any other illness, including cancer and heart disease.
In your experience, what do you think are the biggest things impacting mental health here in North Texas?
Well, I just recently read a Kaiser Family Foundation survey that found over 36% of adults in Texas reported symptoms of anxiety or depressive disorder. And this corresponds to most clients that I see personally. There's many things that affect our mental health: world events, local events, affects both individuals and our collective social conscious, if you will. And substance abuse is another thing that's impacting us here in Texas. The Texas Health and Human Services reported last year that on average, 5 Texans die every day from just fentanyl poisoning alone.
Wow.
And one thing that's near and dear to my heart as a veteran and a survivor of PTSD, 1 in 3 returning troops has PTSD, but only 40% seek help. And here in Texas, we have a large population of military. But it not only affects survivors of combat experience, but it affects people that have experienced terrorist attacks, natural disasters, being abused, harassed, bullied, working in fields of distress such as EMT in the medical field. Suicide rates are going through the roof every time we speak. In 2020, of course, we had 3,900 Texans that lost their lives to suicide. Suicide's the second leading cause of death for individuals 15 to 34.
And those numbers are just alarming, Arlie. We may see some people wearing some green ribbons on their clothes or a tie to really show their support for people that are struggling with mental health illnesses. I know we don't have much time here, but how can we work on improving that?
Well, I think taking time for ourselves, self-care is very important for a person. Therapeutic support, of course, seeking professional help if you need to have a safe place and a supportive environment. Our social support, talking to others to understand how you feel, family members, faith leaders, and people you trust. And lastly, I have to say, practice gratitude. Research shows that consciously practicing gratitude can reduce feelings of anxiety and stress. Studies found that a single act of thoughtful gratitude produces an immediate 10% increase in happiness and a 35% reduction in depressive symptoms. So just take care of each other and be kind.
Great message this morning, Arlie. Arlie Rogers from ThriveWorks, thank you so much for joining us here on Daybreak.